Welcome to the 2021 MKA E-Class webinar on surgical skills. My name is Sori Moon, your master of ceremony for today's event.
Greetings to all participants and viewers. I'm YoonSuk, Director of Global Healthcare Business Department at KIDI.
Hello everyone, I am Professor YoonSuk LEE, colorectal surgeon working at Seoul St. Mary's Hospital, the Catholic University of Korea. First of all, it's my great pleasure to participate in MKA E-Class for colorectal session. Today, my topic is Laparoscopic and Robotic TME.
Hello everyone. It's my pleasure to share my experience in laparoscopic living donor hepatectomy with you.
As you can see in this graph from the recent multi-center study in Korea, including my center, the proportion of laparoscopic donor hepatectomy account for more than 80% in 4 centers in 2018.
Ladies and gentlemen, it's a great honor for me to be here to talk about my topic to many audiences. My topic is intracorporeal anastomosis after laparoscopic gastrectomy. I'm Professor Sang-Geun Kim, working at the Department of Surgery of St. Mary's Hospital, which is one of affiliated hospitals, College of Medicine, the Catholic University of Korea.
And we'll have a Q&A session from now on where they answer pending questions from our students.
The introduction of MIS in the field of rectal cancer, including low rectal cancer, is more than 20 years. Actually, so the penetration rate of MIS in rectal cancer in Korea is.
So in cases with the normal anatomy, vertical stapling is important, which means the vertical direction of the
Anastomosis by layer suture, but nowadays almost all gastric cancer surgery have been done with the laparoscopic or the robotic surgery.
And I would like to thank everyone as well who joined until the end and our participants for enthusiastically giving us questions. And with all these questions, and we'd like to wrap up all these procedures for this online MKA E-Class webinar on surgical skills. And thank you very much once again. And please continue to give your love and support to the online education. Especially once again, we would like to thank to our 3 professors. Thank you very much.
Thank you very much. Thank you.
Bye-bye.
Thank you. Bye-bye.